Have you ever had questions about medications you've been prescribed? Why doctors, psychiatrists, nurses didn't explain it to you when you were first prescribed them? And then you started looking up what your medication side effects were due to having side effects for medications? Well, in this video, we will be discussing the basic differences of benzos. This is your daily dose of mental health. Please like and subscribe. Let's jump right on into this video. In the next video I'll be covering opiates and opioids. Alright, so let's jump right on in. Okay, so this video, as I said, will be covering benzo differences, benzodiazepines. So, a lot of times people will be prescribed either, when it comes to meds for anxiety, either a Xanax, Ativan, Valium, or Klonopin. Sometimes Librium, that's specifically for alcohol. However, the main point I want to get in this is a lot of the differences between these meds. If you want to actually know like what you're taking, what you're actually taking it for, you're gonna have to go and actually research it, because in today's society, as I said, nobody really explains it to you. They just go, all right, I'm feeling this way, here's a script, go get it filled. So today we're gonna be talking the first one, 4 classes of benzos. First one, Xanax. Xanax is typically, today, it is very highly abused. All of them can be, but Xanax is a common one. The onset of when you take it, it will be, it's intermediate, but in my opinion, it's pretty quick when somebody takes a Xanax. And the main reason why Xanax would be prescribed would be for panic attacks. Number 2, Ativan. The onset again is intermediate. In my opinion, Xanax is faster acting than Ativan, but onset as well is intermediate. And another use of Ativan being prescribed would be for seizure disorders, which would be, for example, somebody who has epilepsy. Number 3, Valium. The onset is fast. However, the main difference of why this could be prescribed, which all of them could be prescribed for anxiety, is muscle spasms and seizures. But muscle spasms, another one for Valium. Number 4, Klonopin. The onset of it kicking in is slower, and it lasts a lot longer as well. Valium lasts a lot longer as well too, even though its onset is very quick, and it also is used to treat seizures. This is also typically a long-term benzo that is prescribed for somebody, because it lasts longer and it's more effective at very low doses for longer amounts of time. The one that is the most highly abused is Xanax. So abused most. Ativan, once again, main point is seizures. Valium, muscle spasms, specific types of seizures as well. But the key is that I want everyone to know is all of these are used to treat anxiety. There are basic differences, as I said, in the onsets of them and half-lives. And also, all benzos slow down CNS system by utilizing the brain chemical GABA. GABA, once again, I've covered in another video, is the chemical that will bring down and depress your CNS nervous system, which will inadvertently calm you down. It'll help control and help you bring down or decrease the amount of cortisol you produce. So yeah, that they all utilize the same brain chemical. Once again, right here, all can be addictive if used for more than a month straight, causing tolerance issues. So if you're using any of these for more than a month daily, you should always consult with your doctor about how am I going to get off of this? A taper is typically, for all of them, tapering always necessary. Always, for all of them, once again. And lastly, I always want everyone to know that I'm not calling out doctors or nurses, because I am an RN, on not explaining what these meds are, but the next time you go see your doctor or psychiatrist, ask about, you know, how it works, the onset, side effects, you know, what is my plan long term if I'm going to be taking something like Xanax, Ativan, or Valium, because of the chance of it becoming very, you know, addictive. Klonopin, I brought that one up in particular because that can be used as a long-term benzo with having a lot less problems. One other thing, if you're using these, you know, in particular Valium long-term, would be one long-term side effect is potentially developing dementia or having cognitive issues long-term. So my main point of this, once again, is just remembering to ask your doctors just basic differences between why are we going with this benzo, why are we using Ativan instead of Xanax or Klonopin instead of Valium. In the next video we're going to be covering opiates, opioids, major differences between them, and specific questions you should be asking your doctor on why this is being prescribed, why a specific one is not being prescribed. Once again, please like and subscribe to the channel. This is your daily dose of mental health. Made this short and sweet, but yes, the next video will be covering opiates and opioids and common questions you should ask your doctor and basic differences between the different classes of opiates and opioids. Once again, I love you all. Have a great night. Please like and subscribe. Leave a comment. Peace out. Let's have a great week.